Good morning, ladies and gentlemen. My name is Emanuela Zilli and I am the Chief Medical Officer of Cittadella Hospital in the northeast of Italy, in the province of Padua. Padua represents one of the first areas in Italy where the coronavirus emergency started on February 21st this year. Cittadella Hospital has 380 beds. During the COVID-19 emergency, we have assisted COVID patients and non-COVID patients. The COVID-19 emergency has forced hospitals to face enormous organizational challenges in order to implement solutions to minimize the impact of the pandemic and guarantee at the same time the quality of the health services provided and the safety of patients and healthcare workers. During the acute coronavirus emergency, the local authorities, Health Trust in the district of Padua, has set up 4 levels of risk for every hospital complex in the district, based on the following parameters. First of all, the type of hospitalized patients, COVID positive, COVID-like or COVID negative. Secondly, the type of health services provided. And finally, the time of assistance and care for hospitalized patients. The 4 areas in Cittadella Hospital are red, yellow, green and white. From the highest to the lowest risk, the red area is made up of an intensive care unit, a respiratory intensive care unit, an emergency room, COVID ward, an operating theater, radiology, and so on. In the red area, we have assisted COVID patients. The yellow area is made up of a maternity ward, neonatal intensive care, cardiology intensive care unit, etc. This area also includes the Department of General Medicine, inside which we have a COVID-like ward. In the COVID-like ward, we have assisted patients where symptoms are highly suggestive of COVID-19, but the PCR test for SARS-CoV-2 continues to be negative even after repeated samples. The green area consists in an orthopedic ward, surgical ward, one-day surgery, and outpatients, and finally the white area, which is a support area, includes teaching facility and a hospital pharmacy. The risk stratification in Cittadella Hospital has been applied to different contexts, such as the distribution of personal protective equipment, health surveillance, frequency of cleaning and sanitation. Since February 21st, date of the first confirmed case in the Veneto region, personal protective equipment has been delivered daily to healthcare workers. The quantity and quality of devices provided have been carefully monitored, with particular regard to high-risk setting, that is to say red and yellow areas. By now we have trained 997 healthcare workers in the proper use to the personal protective equipment, 87.7% of the total. The frequency of cleaning and sanitation has been intensified in red and yellow areas, following the guideline released by the World Health Organization. The performance of nasopharyngeal swabs has been periodically organized for every healthcare worker according to the level of risk of their unit, every 10 days for that area, every 20 days for yellow and green areas, and every 30 days for white area. The constitution of 4 levels of risk is proving to be a useful and flexible in the management of the COVID-19 emergency. Further research in the next month needs to be made to assess the impact of the risk stratification on the different aspects covered, for example, the number of healthcare workers infected, and so on. In conclusion, the definition of 4 levels of risk in hospital setting is proving to be a useful and flexible tool in the management of the COVID-19 emergency. Thank you all for your time.